Good morning, and thank you for attending. Today, I'm joined by Dr. Carol Zimbalati, public health physician, who will provide an update on our local COVID-19 situation. Louise Gagne, Executive Director of Community Services, to give an update on our work with schools, and Scott Thibodeau, COVID-19 Clinic Logistics Manager, who will provide an update on the COVID-19 vaccine rollout. Before we proceed, I'd like to take a moment to acknowledge that the health unit resides on land covered by the Robinson-Huron Treaty of 1850. This land is traditional territory of the Anishinaabe people. This land is also part of the unceded territory of the Algonquin Nation. I'd also like to acknowledge the Métis historical presence in the region. As we move into a federal election, it is important to review the policies that affect Indigenous peoples and communities and work together to prioritize these issues as part of the decolonization and reconciliation process. This week, Ontario's Chief Medical Officer of Health made some big announcements, including anyone born in 2009 is now eligible to receive the Pfizer vaccine. They can book an appointment or walk into any of our clinics. The province's Vaccine Clinical Advisory Group has indicated that the following severely immunocompromised populations may benefit from a third dose to complete an extended primary COVID-19 vaccine series. Highest risk individuals include transplant recipients, including solid organ transplant and hematopoietic stem cell transplants. Patients with blood or bone marrow cancers, examples are lymphoma, myeloma, leukemia. Those on active treatment, such as chemotherapy, targeted therapies, immunotherapy, people receiving anti-CD20 medications, and residents of high-risk congregate settings, including long-term care homes, high-risk licensed retirement homes, and First Nations elder care lodges. The third dose should be offered at least 2 months after the second dose for the above groups. An exact timing should be decided with the treating provider in order to optimize the immune response from the vaccine series and minimize delays in management of their underlying condition. Those eligible to receive the booster dose are asked to speak with their primary care provider or clinical specialist managing their health condition regarding the booster dose. The ministry is requiring proof of eligibility in order for you to receive the booster dose. We ask that you not show up to a walk-in clinic expecting to be immunized with a booster dose at this time. Once a plan is in place regarding proof of eligibility, we will make the public aware. Hospitals and home and community care service providers are required to have a COVID-19 vaccination policy for employees, staff, contractors, students, and volunteers. Ambulance services need to have a COVID-19 vaccination policy for paramedics. The vaccination policy must be effective no later than September 7th, 2021, and at a minimum, will require these individuals to provide proof of one of three things: full vaccination against COVID-19, a medical reason for not being vaccinated against COVID-19, or completion of a COVID-19 vaccination educational session. Individuals who do not provide proof of full vaccination against COVID-19 will be required to undertake regular antigen testing. To support the return to school plan, the Ministry of Education intends to introduce a vaccination policy for all publicly funded school board employees and staff in private schools, as well as for all staff in licensed child care settings for the 2021-22 school year. Regular rapid antigen testing will be required for staff who are not immunized against COVID-19. At this time, I do not have any additional information, but the health unit will work with all organizations to help meet their policy and vaccination needs. On a local level, effective immediately, I'm revoking the isolation class order under Section 22 of the Ontario Health Protection and Promotion Act. The class order was put into effect on December 24th, and no charges have been laid under the order. We have reached a time in the pandemic when the class order no longer reflects the management of most high-risk contacts, now that most of the population is immunized against COVID-19. Revoking the class order represents how far we've come and how important immunizations have been in the management of the COVID-19 pandemic. It is important to recognize how well individuals who tested positive and close contacts have followed the self-isolation requirements throughout the pandemic. Individuals who test positive for COVID-19 or those who are identified as unvaccinated or symptomatic close contacts are still required to self-isolate. Individuals who do not comply can still face individual orders under Section 22. However, to date, no instances have required this type of action. With that, I'll pass over to Dr. Zimbalati.
Thank you, Dr. Chirico. I'm pleased to announce that in the last 7 days, we have identified no new cases of COVID-19. Our total case count remains at 661, with 477 in the Nipissing district and 184 in the district of Parry Sound. The health unit currently has 1 active case. Though this is good news that we are not yet following the provincial trend of increasing case numbers, it doesn't necessarily mean that there is no COVID-19 activity in our area. It is very possible that there are individuals in our district who have mild or no symptoms who have not been tested, but could still spread the virus. There are currently no active cases that have tested positive for a variant of concern, and currently no individuals are in hospital due to COVID-19 in our area. Over the past 14 days, 50% of individuals eligible for the vaccine who tested positive for COVID-19 were not fully immunized. A further 2 cases were under the age of 12 and were not yet able to be vaccinated. With that, I will pass it back to Dr. Chirico.
Thank you, Dr. Zimbalati. And we'll have Ms. Gagne to give us an update now. Thank you.
Thank you, Dr. Chirico. Last Friday, the health unit met with all the school boards in our district to commence discussing the plans for September. There was a consensus to have a unified approach to topics such as sports and extracurricular activities across all the school boards. However, the details of the local return to school plan have yet to be decided by the school boards, and these plans may change as needed to adapt to our local or provincial situations. We will continue to assist the school boards as they navigate the new school year. I also remind students and parents, as well as educators and school staff, that they have until August 24th to get their second vaccine to be considered fully vaccinated for the return to school. To find information on an upcoming vaccine clinic, please go to the health unit's website and also follow us on Facebook. With that, I will pass it back to Dr. Chirico.
Thank you, Ms. Gagne. And over to Mr. Thibodeau for the vaccine rollout.
Thank you, Dr. Chirico. Good morning, everyone. As of yesterday at 3 p.m., we are now at 79.8% of residents 12 years of age or older who have received at least 1 dose of COVID-19 vaccine. 72.2% of residents 12 years of age or older are fully vaccinated. Additionally, 67% of youth 12 to 17 years of age have received at least 1 dose of the COVID-19 vaccine, and 53% have received both doses. A total of 172,977 vaccinations have been provided in our district thus far. We are continuing to meet people where they are at and have worked with community partners to offer COVID-19 vaccine clinics on sites. Monday was our last clinic at Memorial Gardens. I would like to thank the City of North Bay and the great staff for their help making mass vaccination clinics a success. I encourage workplaces, community organizations, places of worship, and other groups to request a COVID-19 vaccine clinic through our mobile clinic request form on our website. This form allows eligible groups to submit a request for a mobile vaccination team to come to their site and provide first and second doses of the COVID-19 vaccine. To be eligible, groups must have at least 50 members and have a collective interest in receiving vaccinations on site. So with that, I'll send it back to you, Dr. Chirico.
Thank you, Scott. So that ends our remarks, and now we can take any questions that you might have. We'll try to answer as many as possible. And please associate your name with your question if you can, and you can put it in the chat box on the left of your screen. I'll turn it back over to Catherine now.
Thank you, Dr. Chirico. We currently don't have any submitted questions, so we will give it a minute or two for media to submit the questions. Our first question comes from Mo at My Perry Sound Now. In the health unit's discussion with the school boards regarding the return to class in September, what considerations were or are being made with regards to the Chief Medical Officer of Health, Dr. Morris, says will be a difficult fall and winter? Perhaps Louise would like to answer this one.
Hi, thanks for that question, Mo. So we're still working through the plans with the school boards. So there are the details relating to inclement weather plans, as well as to handle extracurricular activities during the fall and winter are still being worked through, and those details will be released by the school boards as we get closer to the start of the school year. Dr. Chirico, is there anything else that you wish to add with respect to Dr. Moore's comments?
Other than to say that certainly we do expect that there's going to be more cases in the fall, and that we need to take every precaution that we possibly can to ensure that we reduce the risk of return to school, as is really obviously important that the students do return to school. And we'll monitor it very closely and adjust accordingly depending on how the situation unfolds. And one thing that we have learned is that it can change very quickly.
Thank you. Our next question is for Dr. Chirico from Clark at Cogeco News, your TV. Dr. Chirico, will you reevaluate your stance on vaccine passports?
Well, thank you for that question. I'm not exactly sure if you're talking about vaccine passports for international travel, or if you're talking, which I assume that that's what you are talking about. In that case, that's a federal decision to make. I would support anything that will help protect people coming into Canada, as well as people traveling from Canada, to protect the people in the countries that they're going to. I think that it certainly needs to be something that is very secure and cannot be adapted or forged. So if that's in place, I would support that kind of an initiative.
Thank you. Our next question comes from PJ from the Nugget. How has the response been to the mobile clinics? Have there been many so far? How many people have been vaccinated at them? Scott, would you like to answer?
Sure. Thanks, PJ. There have been several mobile clinics so far, and we plan to have several more. The response has been great. People are very happy to see us in the community. We're trying to break down some barriers for people to meet them where they're at, and I really look forward to doing more as the months move on.
Thank you. Our next question is for Louise, and perhaps Dr. Zimbalati or Dr. Chirico would like to add. It comes from Stu from Bay Today. What is the health unit's role in monitoring adequate ventilation in schools?
Hi, Stu. As per the guidelines for returning to school, there are some requirements for schools and school boards to make sure that their ventilation equipment is up to date and adequately maintained throughout the school year, and that would fall to them working with the Ministry of Education should they need any additional support with respect to that. As a partner who works closely with the schools and the school boards, however, if there was additional advice or consultation that was required, we would certainly be there to support that. Dr. Zimbalati or Dr. Chirico, do you have anything further to add?
No. Go ahead, Carol. No, I don't have anything further to add.
Thank you. Our next question is for Dr. Chirico from Clark at Cogeco News Zero TV. The province announced an indefinite pause to step 3. What vaccine levels would you, Dr. Chirico, like to see before exiting step 3?
I think vaccine levels are only one piece of the puzzle, Clark. It's a very good question. Trying to determine, so when would it provide the lowest risk to exit? I think it's dependent on a lot of other factors. I think case counts are important to see what the trend is. Is it going up? Is it going down? How significant is the increase? The other thing that's really important now, with so many people being vaccinated, is what effect is it going to have on our healthcare system, which lags behind the case numbers. So are we seeing increasing numbers of hospitalizations and people on intensive care units or deaths? I think that those factors are even more important than an absolute vaccine level. We know that with the Delta variant, that in order to achieve herd immunity, we'll probably likely need closer to 90%. Those are some of the numbers that have been identified. So I don't know if that is going to be possible to do. So I think that the other factors will carry a lot of weight in determining when we move out of step 3. In general, I think we need to move very, very cautiously. I fully support Dr. Moore in his approach that is to be very cautious and move slowly. And we've learned from past experience that this will ultimately lead to the best chances for a prolonged reopening.
Thank you. And in the same train of thoughts, we have a question from Eric Thompson from the Tribune. Now that the province's reopening plan has been paused, are there any specific vaccination targets the health unit is trying to achieve before the fall?
Could you read that again, sorry?
So now that the province's reopening plan has been paused, are there any specific vaccination targets the health unit is trying to achieve before the fall?
Well, we're trying to reach out to as many people as possible to get vaccinated. And we're targeting populations that may be hard to reach. And we're using multiple venues to reach these people. So not a specific target, but to get as many people vaccinated as we can possibly do. And I think that's a realistic approach to it. Scott, you might have, or Dr. Simbla, you might have some comments.
Yeah. Yeah, I think that's bang on. I think now we're at the point where we really have to really leverage our community partners. And they've been fantastic in our community, in our communities, EMS, and the use of getting to people where they're at, and as well as the expansion of our mobile clinics and having more. I think that's where we're focusing on right now. We're very close to 80% for getting everybody 12 and anybody age 12 and up to 80%. I think we only need 230 more people to get to that number for first doses. So the climb slows down a little bit, but the effort is there, and we're just getting creative and using different strategies to get those needles in arms.
Catherine, if I may just add, as I mentioned earlier in the opening remarks, also want to encourage anyone who is eligible and working within schools, whether they be educators or support staff, as well as children ages 12 to 17 or in the 2009 cohort and early and up, to be vaccinated prior to the return of school. So really targeting that August 24th date to allow folks to be fully, to reap the benefits of being fully vaccinated before they return to the school environment.
Thank you. Our next question would be for Louise from Brad Aubin at My North Bay Now. I understand that plans are yet to be finalized for the school boards, but with the Toronto District School Board passing a raft of motions earlier this week that enhance the province's back to school plan, which includes maintaining cohorts in elementary schools, not allowing children to eat lunch or take recess outside of their cohorts, assemblies will only be held virtually, etc. Can you share if the health unit and the boards are in talks in regards to enhancing the province's protocols here locally?
Thanks, Brad. So the approach that we're taking is working with the guidelines that have been presented to us and working with the school boards who have great experience on what worked previously in the previous school years, and really trying to finalize plans that will reduce the risk as much as possible for students and those working in the schools within this school year. And at this point in time, we have not talked about enhancing their protocols further or making them more strict. However, that it's going to be a fluid thing. So depending on case activities within our community and what's happening provincially, there may be a need to implement enhanced measures throughout the school year. At this point in time, however, we have not discussed enhancing those measures. Dr. Zimbalati, is there anything else you'd like to add?
No, I think you covered it. Thank you, Louise.
Thank you. Going back to Clark's TV about your stance on vaccine passports, Dr. Chirico, Clark clarified that he was referring to vaccine passports specifically for provincial and municipal events. Did you have anything to add to your previous comments?
Yes, thank you for that, Clark. No, I know where you're going with that. I think at this point, I think we have to recognize that it is complicated, for sure, as far as really imposing certain restrictions on vaccinated and unvaccinated patrons of different events and or potentially in businesses. So with regards to businesses and organizations, they have the right and the responsibility to protect people that they work with, people coming into their business and stores. And so they can and do have the authority to restrict entry depending on the circumstances, their business, and in order to protect, as I mentioned, so they can implement those kind of restrictions. As far as doing it provincially or in municipal events, I think it's important that we don't create a system we had before with a response framework where you have certain jurisdictions that have things in place that are much more highly restricted than other places, because we know that people will travel and we know that it's not effective to do. I believe that kind of a situation, and then you have to individualize the venue and what's going on. But I believe for the most part, that should be a provincial decision. Now, there may be some regional variation, but within traveling distances, if you have different restrictive levels, people will travel, and it doesn't really address what you're trying to accomplish, which is reduce the spread.
Thank you. This will be our last question. It comes from Stu from Bay Today, and will be for Dr. Chirico. If this was mid-January with the local case levels and vaccination participation, would winter amenities such as snowmobile trails be open?
Well, if there's snow, I would assume yes, that they would be open. I think the situation that we faced before was that we were in complete shutdown. And people were not obeying the rules. They were not doing what they needed to be doing, and they were traveling from areas to areas. They were in vehicles that with other people that they shouldn't have been in. They were congregating in hotels, motels, parking lots. And there was a significant number of people, and we had to act. And so to answer your question, I think it's a different time right now, and I think a different situation. No one can tell what the future is going to be, but I think that we certainly have to look at not just that, but any risks that become front and center with the pandemic as it changes, and we will need to act depending on what the situation is.
Thank you very much for that. This marks the end of our press conference. Thank you everyone for joining us. A reminder that the recording of this press conference will be posted later today on our website. We'll see you all shortly. Thank you.